Malaria is one of the commonest diseases that disturb the well-being of pregnant women. It can cause a lot of complications to the mother and to the unborn baby. At the same time, it can cause distress, financial distress, and otherwise to the partner, to the husband. And that is why it is important we talk today about how to prevent malaria in pregnancy. Malaria is common with us, is ever with us. Until a permanent cure or very effective vaccine is found. So today I'll be talking about ways, cheap ways, common ways that we can prevent a pregnant woman from contracting malaria. I'm going to start with things that lie in the hand of the husband, the family, the household. Now we know that mosquitoes, which are the insects through which malaria is transmitted, usually thrive in a bushy environment. It thrive where there are stagnant waters. So the first step to prevent a pregnant woman from contracting malaria is to ensure that the abode, the house where the woman stays, is not surrounded by bushes. There are no stagnant water. We do not allow water to gather in drums, in pots, in vessels around the house, so that mosquito will not have an area to breed. This is very easy and cheap, is in our hands. So I want to advocate that we should ensure that our vicinities is completely clear of bushes, of stagnant water that will provide a very good breeding ground for mosquitoes. And this will reduce the exposure of pregnant women to mosquitoes. Very importantly too, when the woman is already pregnant, there are some things we do in the hospital. Some medications we give to prevent malaria. But before I go to the medications, there are something we also do which these days they are distributed freely to pregnant women and their households. Insecticide treated mosquito nets is also another very important way to prevent mosquito bites. They are effective and they are easily and freely distributed. So it is advised that pregnant women and their young children, even the husband, might join out of love to sleep under insecticide treated nets to reduce exposure to mosquito. One common complaint from pregnant women about the use of this net is because it is usually generate heat. They complain that when they sleep under these nets, it's usually hot and they are not comfortable. Well, we know the challenge of energy supply we have in the country, but fan, whether through rechargeable fan or otherwise, can provide a temporary relief from the heat that these mosquitoes, from the heat that these mosquito nets pose to the pregnant woman and the people sleeping under the net. Now, when it comes to the hospital, after the pregnant woman has registered for antenatal care, there are some steps we also take to prevent malaria. From generally speaking, for most categories of pregnant women, from after 5 months, we give a medication, I think once in a month, at least 4 weeks apart, to prevent malaria. The popular fancida is usually given to pregnant women after they have beyond 5 months to prevent malaria. And a minimum of about 2 doses is usually given to every pregnant woman, provided the woman does not have allergy to the particular drug I've mentioned. For those who cannot tolerate this, there are other options we usually use. There is a popular drug in Nigeria, used to be popular then, that they call Sunday because it is given once a week. So it acquired the name Sunday from the fact that pregnant women will be advised to take them on Sundays when they are not likely to forget. Once every week. It's also useful in some categories of women to prevent malaria. And for those who are sicklers, there's another type of medication we usually give, they take every day because they are particularly prone to having malaria. They take this medication every day to protect them against malaria. It is important for the pregnant one to register in an appropriate hospital where the appropriate medication to be given will be known and will be administered at the right time to the pregnant woman. And this medication I've mentioned should not be generally construed. Every pregnant will go and buy this drug I'm taking. I'm just highlighting steps we take to prevent malaria in pregnancy. It is particularly important in conclusion to know that malaria should be prevented by all means in a pregnant woman, because malaria is associated with a lot of complications. It may make the pregnant woman to have low blood level, called anemia. It can make the unborn baby to be small for size. The unborn baby can also die without complication. The baby can also be born with malaria. So those are some of the complications that malaria can cause to a pregnant woman and unborn baby. So necessary steps should be taken to prevent a pregnant woman from having malaria. Thank you.